Good evening, Mountain House. Welcome to MoHoTV. This is our second episode of Mountain House Health Matters. And we've got two guests tonight planned on the schedule here. My name is Brian Harrison. I am your host with the MoHoTV. I'm here with Khalid Saleh, who is running our board and producing all of this for us in the live stream. And tonight we have Dr. Joe Garrido is with us right now from Valley Chiropractic. I've known Dr. Joe, I think, since,
yeah, it's got to be 7, 8 years. Yeah.
So we're going to talk about some health issues. He's got some plans to tell us the top things you can do to start your 2025 in a healthy fashion. It's not too late.
Not too late. It's too early.
So welcome, Dr. Joe.
Thank you.
Nice
Appreciate it, Brian. Thank you for having me. I'm glad to be here to share things I picked up along the way to help our community out with their health. Yeah.
We were in a networking, I'm still part of a networking group, the BNI group, and Dr. Joe was part of that group for a long time. And every week we'd get together and he would have some great stories to tell. So
yeah.
I'm happy to have you here. I'm hoping you can tell us a little bit about how you came into chiropractic.
Yeah.
I know you have some good stories there.
And,
and just kind of give us a little background, then we can get into your top things.
Sure. I'll share how I got into chiropractic and again offer you guys ways that you can improve upon your health this year. So, chiropractic. How did I get involved? I had seizures as a young man. Started at the age of about 9 years old, and small feelings of seizure, but it really progressed when I turned 13. And
puberty kind of got you.
Puberty got me, yeah. And then we went to all the medical specialists. My mom was a nurse at the time. My dad was in the Navy, so we had access to every diagnostic you can think of to figure out what's going on. And they couldn't diagnose it as traditional seizure problems. So,
was it epilepsy?
They couldn't, like it wasn't conventionally called, it wasn't conventionally diagnosed as epilepsy. So we began this whole long kind of process to figure out what was going on. And in the end, I was, they said it was psychosomatic, right? So they sent me to a psychiatrist. And I was, I was young, and I knew at that time, no, I'm not making this up. This is actually happening. And
it's kind of rude.
Kind of rude, right? Yeah. And it began kind of a mistrust. That started my mistrust in terms of the system offering information about what's going on. So the healthcare industry, that started my mistrust. So long story short is that I went to a chiropractor in my young 20s. He did x-rays. He discovered my atlas was just way out of position. And then he adjusted me, and then I've been seizure-free ever since. And then I decided first I was like, this is amazing. I had no idea of chiropractic up until then. Again, my mom was a nurse, and for the most part, we grew up in sort of the traditional, medicine is the cure sort of lifestyle. And then I began this whole journey to go into chiropractic. Now, it took me a while because I actually went to chiropractic school, and then I decided I didn't want to go to that school. I wanted to go to a different school. And my mom at the time was doing real estate. And she said, hey, come work for me for a few months before you start school. And then that became 8 years.
Oh, wow.
So I became a real estate broker and all that. But I eventually,
I knew that about you.
Yeah. And so then I eventually went back into chiropractic, and it just sort of really opened my eyes up to, the innate ability of your body's ability to heal, right? And so then I began that journey. I've been now doing chiropractic for close to 20 years if you count my 2 clinical years in chiropractic school. So I've had a world of experience around health and seeing people recover and heal from things that traditionally you may have not thought it was possible. So I have a really strong belief system in the body's ability to heal. So that's kind of my origin story.
I have a question with all that.
Yeah.
So you had that experience where they fixed the seizure issue in your early 20s?
Yes.
Did you continue to get adjustments through that time?
Yeah, I followed his protocol. There's a chiropractor in Fremont, and he said, come 3 times a week. This idea that we can adjust you once, but it may return back. You have a kind of a muscle memory, right? So you got to sort of retrain the system to kind of hold position. So I followed his advice 3 times a week for a couple weeks, then it was twice a week, and then it was once a week, and then finally, once a month, and the seizures just went away, and it was sort of amazing. The first adjustment, I knew, it felt like I'd been under this pressure, and it just sort of just released, and then I knew that there was something to this, and I had to figure this out, and then that's when I was like, I think I'm gonna become a chiropractor because this is amazing. And while I was in school, a lot of my classmates had that similar experience. Maybe it wasn't seizures, maybe it was low back pain, or it was some chronic thing. They went to their chiropractor not knowing much about chiropractic, healed them, and then they decided they wanted to become a chiropractor, excuse me. So, oh, thank you. Yeah, so that's kind of that I followed his protocol. Mm-hmm.
I didn't know the whole real estate thing in between.
Oh yeah.
And you still maintained that desire to be a chiropractor even after you
Yeah. Really, I was just a young man. There was good money at the time, and I kind of figured I was going to save money to pay for chiropractic school. That's why I went into it. But I was a young man, and so I didn't save any money. I spent all of that money. So yeah, and my family's in real estate.
Okay.
So
Just don't give me a guitar.
oh yeah, don't give. He's a good player, by the way.
Anyway, yeah. So you went to chiropractic school.
Yeah.
And you had a practice in Fremont, right? Walnut Creek. Both?
Yeah. I originally was an associate. I was associate 3 times. My first associateship was in Pleasant Hill, and I had it was an interesting model. It was it was a medical doctor, some physical therapists, and a number of us chiropractors as an integrated health system. And so I did that for about a year or so, and then I left that to go work at a completely opposite style of chiropractic, where it was just strictly they call it straight chiropractic. There was no PT equipment. There was just adjustments alone, and that was it. And so that was like an entirely different model. And then I did that for about close to a year, and then I went to another place in Dublin. That second place was in San Ramon. My third associateship was in Dublin, where it was kind of a mix, kind of similar to what I do now, chiropractic with some PT, some pre-therapy like waterbed, roller bed. So.
Well, and you have a very holistic approach to what you like to do generally anyway.
I do, yeah. We like to use everything that, my personal approach is to use whatever works. And so many things work for the mass of people. Some things work specifically for a smaller group. And then you sort of have to, as part of the art of chiropractic, is to figure out exactly what works for that person and then tailor it to their specific needs. And I know that other people who have had chiropractic in the past sort of like that sort of tailored approach to their own personal health care. So yeah, I like to have a whole bunch of tools in the tool chest and kind of use as needed for that particular person in front of me.
How long have you lived in Mountain House?
We're at about 12, 13 years. Yeah.
And you're a partner in the local Valley Chiropractic practice here in Mountain House,
Mm-hmm.
and you guys have other shops
Yes.
in the South County area.
Yes. We have an office in Tracy, Manteca, and just recently we opened up a new office in Ripon about a month ago. Yeah.
Cover the bases pretty well.
Cover the bases, yeah.
You have 6 doctors total, and you kind of rotate where?
6 doctors, we rotate. I'm mostly in Mountain House and Tracy right now, and so we kind of spread out, and we may be shifting that schedule down the road, but that's as it stands. I'm mostly in Mountain House and Tracy. And the idea, the vision is to empower the health of the Valley, and so if that means we open up more offices because we are helping more people, then so be it. And maybe we have a few more offices down the road. That's our current vision.
It's a sound vision. It seems to be
absolutely.
working.
Yeah, absolutely.
And you guys took up that space in the Wickland Center, and whenever that
Been there
was,
since- yeah, that's
6
about
years
it.
ago, so 7, 6.
That office?
Yeah.
Probably a good 10, 11 years ago.
Was
I
it
think.
that long ago?
Yeah.
The whole thing with COVID, I can't
Oh,
remember
yeah.
what year was what anymore.
Sure, absolutely.
Not from having COVID, I have never had it.
Yeah, good for you. I don't think you want it,
No,
Brian.
I don't think I do. Anyway, so you've done an exceptional job. You've become an integrated part of the community. People in town know you. Your wife is a teacher at one of our K-8 schools,
Hanson.
Hanson. So yeah, it's a